I want to talk about the benefits of vaginal estrogen. So this is not something that you need to wait until your symptoms are so bad before you start. This is something that if taken early enough in the perimenopausal period, you can prevent genital urinary syndrome of menopause from getting worse. Here's the thing. These symptoms, so vaginal dryness, vaginal atrophy, burning when you pee, frequent urination, painful intercourse, these are not symptoms that will subside once you've moved through menopause. These are symptoms that will continue to get worse as you age. And this matters. I see this as a nurse, and I want to help be part of this change. I see women, and I have cared for women years ago in my practice when I was a new nurse, where they ended up getting urinary tract infections frequently. And then what happened? They got confused. And then what happened? They fell out of bed, and then they broke a hip and they didn't recover, and they ended up dying. This is not an uncommon story for women. And I think about how could have starting on vaginal estrogen, whether they were 40 or if we had started it on them when they were 70 or 75, how could have that made a difference in terms of how their life played out? And I think it could have. Vaginal estrogen does prevent urinary tract infections. It can play a role in prevention. It can play a role in making sex more comfortable, making less vaginal burning, less burning when you pee. It is something that is safe. Women who have had breast cancer can take vaginal estrogen. There's really very, very limited contraindications to this drug, and there's different formulations. You can take it with a tab, you can use a cream, there is a ring, there is options, but it is good for symptoms in perimenopause and menopause, but it is also good for longevity. It's an important conversation that us as women have with our healthcare providers, and we should advocate for ourselves to get to be on it because the risks aren't really there, but there are many, many benefits.